again, quite an applied research, practically focused talk. I'm from the medical school, where I lead a portfolio of research on using routinely collected health data for epidemiology, statistics, machine learning, and a little bit of AI. So I wanted to share that with you today, in case it's of interest to any of you who want to apply your data analytics skills on more applied real-life data sets. So I'll be covering NHS routinely collected data resources, why I think they're great for starting with AI and machine learning projects, and what we can offer you in the medical school. So over the last 3 to 4 years, the NHS and the government have developed this data for research and development programme nationally across England. And they've been encouraging hospitals and sort of regional areas of the NHS to curate their data into linked data sets, anonymized and ready for research. And then these are being deposited in what are called secure data environments. So they're population coverage, NHS data. They're used on the basis of kind of de-identification, anonymity, and therefore without patient consent. So they need to be treated very securely. And so they're put into a kind of cloud computing infrastructure that you can apply to use for your research, and then you would get a login and log into their environment to do your analysis. So we have a local one, Kent, Medway, and Sussex, who have been working really closely with. And within that, we have a, you can't see the very top of that slide, but it's called the, sorry? Okay, Sussex Integrated Data Set. So this covers East and West Sussex and Brighton and Hove. Do you want me to click on it?
Yeah.
Well, it doesn't want to. Never mind.
Yes.
So back to Sussex Integrated Data Set. Covers about 1.7, 1.8 million people living across the whole of Sussex, East and West, and Brighton and Hove. And our local health system has worked really hard to get 95% of GPs signed up and flowing data into this. All the hospital trusts, social care data from the local authorities, ambulance data, mental health data, community trust data like district nursing is all flowing in. Each patient has a unique pseudo ID, so you can track them across services and over time. If you're not particularly interested in local problems, you can look at more national ones. There is a curated gateway here where you've got metadata on all the national data sets, which can be really interesting to use as well. That's a health data research gateway. Why do I think you would like to know about this? Well, these are big data sets. So there's large population coverage and longitudinal data. So we can tackle research questions across the whole population. Between 98 and 100% of people are registered with a GP in England. And this means that there's data available on groups who often wouldn't necessarily take part in research. And while, of course, our medical records don't contain every piece of information about us, we can get a wide range of socio-demographic, clinical, medical history factors. And we can ask questions around who has access to healthcare, how long does it take to get a diagnosis, do people get the correct treatment, what types of treatment led to what kinds of outcomes. So we've been using this over time for kind of prediction and early detection modelling. Here you can see a paper I have published with some Manchester colleagues around predicting risk of dementia. Because there are many signals or predictors or risk factors recorded over time in patient records that can be combined in statistical or machine learning to create prediction or early detection tools. And then we can start embedding them in practice and doing prevention interventions. One example that we've run in Sussex with the School of Psychology, led by Professor Cathy Greenwood, was that we took mental health records from patients already known to mental health services. We used their demographics, previous mental health diagnoses, and new signs and symptoms recorded in their clinic notes, combined in a regression model to replicate a risk calculator for their risk of developing psychosis in the future. And then when we had ascertained its accuracy, this was then taken back to live patient data to run in a trial to offer those patients an intervention. So if you are interested, I can't tell you everything about it, but we've created a website to support people getting access to these data sets. It's called the ARC Data Science Hub. It's embedded in the BSMS website. We've made resource packs for all local and national data sets. You can understand what's in there and whether they might be useful for your project. There's a page on how to get access to that local data set I talked to you about, and also some scripts like Python scripts and ways of developing code lists, case definitions, just to get you started with what is very messy data. And the great news is we've been funded by the NHR till 2031. We're also supporting other kinds of data, little bespoke projects, and we're trying to matchmake Sussex researchers from Sussex AI, from informatics, who are interested in applied problems with our local NHS doctors and other clinicians who have, say, imaging data sets, other kinds of data sets that are not currently in the SDE. So do look out for adverts for those kind of matchmaking events if you're interested in these applied projects and would like to be linked up with a doctor who's got a data set and a research problem. So those are my contact details, and I seem to have come in under time, so that's good.
Well done. Thank you, Liz. Okay, so we have plenty of time for any questions for Liz.
Yeah, I was wondering whether you could say a few words how cumbersome a process would be to start any of these projects. I mean, so is there a lot of ethical review involved or other checks?
So generally these data sets that are sort of standing data sets that you then apply for access to, they have an overarching ethics approval. So what you need to do is write a project that demonstrates the sort of public patient benefit of your project, and that will go through their data access committee. You then also need to have your organization registered with them as a trustworthy organization. So that would be Sussex. We're trying to get that on board. We've done that with one data set called CPRD. We're trying to do it with the SDE. That should be done. And then you need to sign a sort of contract for your good behavior when you use the data as a user. So theoretically, it should be done in what, sort of 2-3 months? In practice, it can take a bit longer as you negotiate over what you actually need in your sample and those kind of things.